The Bizzare can strike at any place and at any time. And sometimes, as you pass through the doors of A&E, you just can't put your finger on where it all went wrong.
Kristen Fox.
Yay.
Kristen Fox knows that feeling.
I was working on my car, hence the grease.
Kristen heard a funny noise coming from his vehicle and decided to investigate. But when he went to support himself, he missed his motor and put his finger in the fan belt, so that instead of cooling the car engine, he pulped his pinky's tip.
I'm not looking. Oh, that really is pretty.
Does that hurt there?
No.
Does that hurt there?
Yeah. Ah, that really hurts.
I know, I'm just putting some pressure on it, and that's the reason why it hurts. Come on then, let's go through. I'll get you cleaned up.
Bizarrely, Kristen seems more concerned about the state of his stomach than the future of his finger.
I could do with a burger.
But this is a hospital, not a hot dog joint, and Kristen needs nursing, not nosh.
Oh, bollocks, that really is a mess. Yeah.
So after a new dressing that won't stick to the wound and some long-awaited pain relief, it's off to X-ray for Kristen. If the bone is broken, he may need reconstructive surgery, and that's not all.
Even worse than that, God forbid, he gets a very nasty infection which will lead ultimately to amputation of his finger.
As the radiographer zaps away, the prospect of plastic surgery has our patient pondering possible extras.
I've got about 1.5 stone of fat bits you can get rid of.
But Kristen's fantasy of surgical fat reduction is quickly shot down by the arrival of the plastics consultant. And who better to deal with a motoring mishap than Mr. Schumacher?
So the X-ray, there was no fracture.
There's no fracture.
It looks very dramatic, but I think it's worth probably just a very good wash. Maybe put a ring block and have a look if there's any bone exposed. Probably not.
Fingertips, or pulps as the doctors call them, are a complex web of nerve endings. They're impossible to reconstruct in a way that will bring back sensation.
We'll give it a good clean and then start digging deep.
You have such a nice way of saying that, don't you?
With bony injury ruled out, Kristen just needs an old-fashioned wash.
Needles.
You hate needles.
Before Dr. Asif can clean the wound, he'll perform a ring block, which involves numbing the two nerves that enter the finger at the point where rings are worn.
This will be a sharp scratch, and it does sting a little bit.
Oh, bloody hell, it does sting a lot.
I'll go in slowly.
Ah!
Sorry.
I'm really enjoying this, as you can tell.
OK, well, what I'll do is, whilst it's kicking in, I'll just clean it with some a syringe and saline.
As Dr. Asif scrubs what's left of that middle finger, a question occurs to Kristen.
I suppose I won't grow a finger back. Grow back? Would it grow back?
Well, it wouldn't grow back normally, but you'll get the tissue coming back, right. Or it should heal pretty well.
Although the tissue will recover, the surface of the fingertip will never be quite the same, which could cause 1 or 2 problems.
You'll just have to be wary when you're making rude gestures. So your finger's nice and clean now, OK? Then you can go home and treat yourself to McDonald's or something.
Kristen will need antibiotics and regular checkups to make sure his finger is healing. But essentially, this is just a case of letting Mother Nature take its course. And as he prepares to head home, there's one thing on the mind of Master Fox.
I am absolutely famished, so I think a Chinese is in the off in New Zealand, so I'm really quite excited about that. Take my mind off things.